If you've been dealing with some kind of nasty, piercing pain involving your face, your jaw, maybe your eye, maybe even the back of your head, and especially if you've had all of the tests, you've had the brain MRI, but it came back as normal and you're trying to figure out what's going on, I want to ask you a really important question. Is it neuralgia or is it your neck? Hi, this is Dr. Jeffrey Hanna at Atlas Health Australia, and I want to show you in a quick little video here about the connection between what's happening in the health of your neck, particularly right up at the top here, and how that can be contributing to the pain of trigeminal neuralgia or the pain of what's called a myofascial pain syndrome, something like a fibromyalgia. So what I've done here is I've gone ahead and I've drawn you a fun little basic picture of your head, the brain, and then of the top vertebrae in your neck called the C1, the C2, the C3, the C4. Don't worry, this is not going to be an extensive neurology lesson. Now what I want to do is just pull up a little model here just so I can show you here that what we've got is what you would the back of the skull, and then in between each of these vertebrae are going to be coming out a series of little nerves. And the nerves from here are going to be responsible for going to and supplying the sensation and pain information from the head. Now you might be wondering, okay, well what does this have to do with a neuralgia? Here's the reason. If we were going to look at the brain right here, and if I was to draw a little blue dot like this, okay, that is, if you would, the processing center for the information that's coming from the branches of the trigeminal nerve. If you've been experiencing this for any length of time, you know how severe it can be either along here, through here, or through your teeth. So the information, if it's coming from the trigeminal nerve, it's going to go into this part of the brain. But there's more to it than that, and it's because that processing center actually descends down through the base of your brain stem, through the level of your C1 vertebra, and down to the level of about C2. So it's a continuous cluster like this. And so if you are experiencing the pain, it can be because, yes, something wrong with the trigeminal nerve, and this is something that you could usually see on an MRI. However, if the MRI has come back as normal, what you're most likely dealing with is a functional condition where for some reason this part of the brain is not working right, or it's receiving faulty information, kind of like a computer virus or something like that. And here's the thing about it, that information could be coming from the trigeminal nerve, or it could actually be coming from the other nerves, the ones particularly at the top of the neck, with major emphasis on the C2 nerve, because that's going to be the one that's going to be supplying the most amount of information into that exact same part of your brain that's processing the sensation of facial pain. So what can happen is that if you've got a bunch of bad information coming from here, possibly because of an old injury that you've just never had diagnosed, nobody's ever properly assessed it or anything like that, if it's sending in the bad information, think of it almost like a wire gets crisscrossed, and then all of a sudden you go on to develop this kind of pain, but nobody can quite figure out what's going on. It's because the issue may not actually be with your brain, the issue may actually be with your neck. So I want to ask you this, is if you've been dealing with trigeminal neuralgia but nobody can quite figure out what's going on, who's had a look at your neck, particularly the C1 and the C2 vertebra, because of their profound significance in affecting how this entire system can work. So if you need a little bit more information, what I'd like you to do is I'd like you to go over to our website, which is atlashealth.com.au, where you're going to find a whole bunch of other information about the relationship between the neck and how the particular kind of work that we provide here at Atlas Health in Brisbane may be able to help you if you're dealing with a neuralgia or if you're dealing also with a chronic pain syndrome. This is Dr. Jeffrey Hanna at Atlas Health Australia.